All right, clinical conversations on the Smart Chiropractor Show. This week, we are going to highlight a featured guest from our Axis event earlier in 2021, Dr. Josh Satterlee, Clinic Gym Hybrid Model. He is put together a fantastic presentation around managing athletes through progression and regression in your practice. I don't think there's a chiropractor out there that doesn't treat an athlete of some kind. As we like to say, there's an athlete in all of us. But we'll let Dr. Josh Satterlee take it away with a little bit of how to manage, how you can best manage athletes through progression and regression in your practice right about now.
Hey, and welcome to this presentation about managing athletes through progressions and regressions. My name is Dr. Josh Satterlee, and I'm so excited that you're here. I'm glad you are part of this Axis Summit. I think this is a very exciting time and very exciting information. I looked at the lineup and there are some incredible speakers. So very excited that you're spending this time with me. My goal today in the next half hour is to go through some basics, I think, of an overview of how to manage athletes. Now, in my career, I have worked with quite a few athletes in my time, from professionals, NBA players, Major League Baseball players, professional golfers, and a lot of minor league and collegiate golfers. I have worked in the golf industry for a lot of years because, well, I like working with golfers and I like golfing. So I guess I live vicariously through my patients because typically they're much better than I am. But over the next 30 minutes, I want to go over some tips and tricks that I've learned for managing athletes and helping them progress, and discuss the ability for you to progress and regress your clients appropriately, because I think that's the secret tool to managing athletes. So once again, my name is Dr. Josh Satterlee. I live out here in Las Vegas, Nevada. It's currently 115 degrees outside as I record this. That's the downside of the desert. The upside is in the fall and spring, we get a ton of great days to play golf and have fun. So I guess it's a big trade-off. But I'm an instructor for the Titles Performance Institute. I also teach for the North American Sports Medicine Institute, which teaches mostly physical therapists. So I'm the lone chiropractor in that group, and it's great. I also teach for functional movement systems, teaching the SFMA, and I was an adjunct professor at Cleveland University, Kansas City, teaching the sports electives program. So I've been a chiropractor for 15 years. I love what we're doing, and I don't think there has ever been a better time to be a chiropractor. So thank you so much for joining me today. So how do we manage athletes? I think the most important thing with athletes that I've learned from both the clinical perspective and a marketing perspective, business does affect our clinical skills, but the most important thing you have to do is give that athlete a picture of a bigger future. And to me, what that means is, obviously for this runner, it's competing at the Olympics, right? That's probably her long-term goal. But it's not just with professional athletes or high-level Olympians. I work with golfers all the time, old, crusty, beat-up golfers that love playing the game. They have the time and money to do so, and they want to get better. And so if we can progress them to get better, they will stick with us as long as we want. So that's kind of how I manage. Now, how do you start that relationship? None of these four guys, I imagine, can do a heavy weighted squat as part of their rehab, although that might be what we want to end with. So what I've learned is we have to regress their exercises, their rehab, to a point where they can start to perform it and perform that without pain. If we can do that, then we can progress them on and they will stick with us, and we can manage that athlete because they will stick with us. If the athlete leaves, you can't manage them. So we're going to talk about how to do that and a simple system I have found for setting it up. So here's the typical overview of what I see in clinical care for people, especially athletes. First, you have to eliminate pain. In my experience, most athletes come into a chiropractor's office, even if it's attached to a gym, with the goal of eliminating some pain. Sometimes they want to eliminate a certain performance limiter, but most of the time it's to eliminate pain. Once they eliminate pain, we're going to help them retrain their movement. So what I mean by that is, if they had pain with moving their shoulder to throw a baseball, we want to make sure they can move their shoulder without that pain and retrain it in a healthy range of motion. Once that can be accomplished, we want to help them, what I call, buy insurance. And how do we buy insurance? We reload the pattern. So instead of, if somebody has pain when they bend over to touch their toes, before they leave my office, I want to know they don't have pain while bending over with weight for multiple reps. I don't want to just know that they're pain-free on the table. I want to take them all the way into a loaded pattern so that we buy insurance. We know that they're not going to get re-injured, because I think that makes us look like a rookie, and I don't want to be a rookie. I want to play on the varsity squad. So we want to eliminate pain, then retrain movement, and then reload patterns. In my experience, and obviously my experience is different than yours, this can usually happen within one visit. Sometimes it takes 2 or 3 visits, but usually in one visit, you can start eliminating pain, start retraining movements, and start reloading. If they're super acute, like a very acute disc herniation that also has some radiculopathy, it will take multiple days. But this should be part of almost every single visit. All right. Now, this also creates a great business model. Eliminating pain and retraining movements is the role of a clinic. When we get into reloading patterns, sure, there are some clinics that reload that include that in their business plan, but there are a lot of gyms that start at that reloading pattern and take it from there, progress it from there. So at the end, I'm going to talk about a business model that I think is the best, which includes all these aspects and a future bigger than the current setup, and that is what we call a clinic gym hybrid. We're going to add a gym onto a clinic so that it grows and you can keep progressing. But with that, let's go on. I'm making some assumptions in this presentation. Here's my assumptions. Number one, that you are an expert at assessing people and diagnosing correctly. If you haven't done that, there's a lot of training out there. I love the SFMA. I teach it because I think it's a great diagnostic system, but I think you got to be there. If you can't diagnose or you can't understand the injury or even get as granular as measuring range of motion and whatnot, that's the first goal rather than teaching progressions or regressions, which I'm going to cover here. Second thing, I'm going to assume, by the way, that you have a lot of tools in your bucket, that you have, you can maybe do dry needling, soft tissue work, obviously adjusting, and that you're very good at those things to eliminate pain. If you don't have that, I would recommend doing that first. But if you can already do that, let's help manage these athletes through progressing them through rehab exercises into big exercises. But it's built on the assumption that you can diagnose and treat to eliminate pain. If you can do those things, then let's move forward. So imagine the basis of regressions and progressions, which I think are the basis for managing athletes at a high level. Imagine you had a runner and she came into your office and reported, every time I lunge, I have pain in my knee, right? Based on that very simplistic model I presented before, obviously you're going to diagnose her, you're going to assess, and you're going to find out why she has pain in her knee. Upon getting close to discharge, I think one of the things we all agree on is that we want to eliminate that pain and make sure that she can do that pattern without pain. So I'd ask her to do an unloaded split squat in the office. It gets into similar ranges of motion of the knee, and it puts pressure on that structure to make sure that we're testing it properly. But what would be our end goal with that? Well, I think you'd want to add weight. And if we add weight, we would call that a progression. It's progressively getting harder, right? How much weight do you add? Well, we're going to talk about that later, but we want to progress her from just using her body weight to using external load. Now, let's say you run into trouble because athletes oftentimes don't come in at the first sight of pain. They really ingrain that painful pattern because they're high-level competitors and they don't want to be slowed down. But they finally admit, hey, I do have a problem. She comes in and she can't do that split squat as part of a rehab. So what do you do then? Well, then we want to regress that exercise. We don't just say, hey, you can't do split squats, it's too painful. We want to regress it. And an easy regression for the split squat is to add a TRX. A TRX support allows her to offload some of the weight. We get into the same patterns, but more of the force can be handled in the upper body, and maybe that gives her the ability to perform it. So we have both a progression and a regression. And then that body weight split squat may be the standard that we're looking for, right? Now, we want to also establish maybe some weights that we want to progress to. We want to establish what's our baseline, things like that. But this is the basic idea of a progression and a regression. Start with a simple body weight exercise, progress it, and also be able to regress it as well. So how do you do this? I think that this needs to be, you need to have the ability to do this at every different exercise that you offer your patients. But so many times I see people can only figure it out by reducing weight. And I think that's a mistake. So we're going to cover some ways to do this, but I think there's a simple system that I call the Bops system, all right? Bops. What Bops stands for is buckets, organize, prune, and standards. And what do I mean? First, identify the buckets of movement that you want to have, that you see athletes doing, that you see your patients doing. Second, organize all of the exercises in your rehab continuum into those buckets so that we can organize this and and know which patterns really are affected and where we need to build more regressions and more progressions. Maybe we're lacking somewhere. Third, we're going to prune all the ones that don't work. Maybe they don't work in your facility for size, equipment, the population you work in, but we're going to prune some off. Like we might see great exercises out there, but they just don't work in our situation. That's fine. We're going to find the ones that really do work. And then finally, we're going to set a standard or an expectation, a certain level for that exercise or for that bucket of exercise. And that standard can be standard upon discharge, like we expect you to reach this level before we boot you, or we can accept that as our goal for all of our athletes to have their bucket full to that level, right? So we see that kind of like, think about like a physical aptitude test or maybe going in the military. They say, hey, our standard is running 1.5 miles in 12 minutes. That's just their standard. And you have to fill that bucket. Some people may run it much faster. And if you can't run it in 12 minutes, they want to know why. Build our buckets, organize our exercises, prune off the ones that don't work, and then set a standard for that bucket. All right. So first step is create your buckets. And here's kind of what I think of this. All of the exercises that we give our patients all can be basically put into a certain bucket of movement. So let's think about the squat bucket. Here we go. So that could be wall balls, right? That could be box jumps, right? And that could be the goblet squat. But all of those exercises, if we look fundamentally, are versions of squats. So I would call this the squat bucket. We want them to have an ankle, knee, hip, and spine strategy to perform this. They need to be able to resist the flexion and extension of their spine while moving their lower body. And then these can just be a progression and regression. So in this case, I would say that goblet squat's probably the most regressed of these three exercises. And depending on the amount of load, I would say that the box jump is the most progressed. Wall ball is between those two. And that's assuming that the ball is not super heavy on the wall balls. But maybe if that ball gets really heavy, that's a progression instead of box jumps. But it's for you to decide and organize, and we'll talk about how to do that. So let's look at some other exercises. All right, here's a woman doing a one-arm cable pull. All right, she's sitting down, one-arm cable pull. And here's a guy doing a rope climb. Are these a similar exercise? And finally, we have our TRX row, right? So what would you call all these exercises? I think they all end up in one bucket. Can you think of what bucket it is? We would call that the horizontal pulling bucket, AKA rowing, okay? If you think about the motion of the arm and the upper extremity, in all those exercises, it's basically the same. We go from a protracted shoulder blade and an extended arm into a flexed arm and a retracted, depressed shoulder blade, right? It's in the end goal, that's it. Even that rope climb that looks nothing like that TRX row is going from protraction to retraction, going from extension to flexion. It's very simple. So we can classify all those. Obviously, the TRX rows might be the easiest, although in this case, I would say the seated row would be the easiest because you're fully supported by that chair. TRX row, now we're involving your core and stability, and then obviously the rope climb is probably the toughest or the most progressed out of all those exercises. So how many buckets are there? Well, let's talk about it. I think there are 10 buckets that we can put all of our exercises in. There's that horizontal row bucket that we just saw in the TRX row, rope climb, and seated cable pull. Then we have horizontal push, and that'd be like push-ups. We have our vertical pulling bucket, which would be pull-ups, vertical pushing bucket, which would be like an overhead press. Then we have hip hinge, which would be a deadlift or kettlebell swing. We have single leg hip hinge, and that would be like a single leg RDL. We have our squat pattern. Obviously, that'd just be like an air squat. And then our split squat pattern, which I think a rear foot elevated split squat is kind of the standard there. Then we have core exercises that are anti-extension, like planks, right? We don't want to see that sagging, extended lumbar spine. And we have anti-rotation core exercises like the Palloff press and exercises like that. So I would challenge you. I think that there's 10 buckets. You might know of an 11th, 12th, or you might say, hey, I combined two. I recently, up till last year, I didn't split the hip hinge and single leg hip hinge. I now do that because I think it's probably in my training, in my athletes, I would say 2/3 of it is a single leg hip hinge, and then 1/3 is a bilateral stance deadlift. I do the same thing with squat pattern. I want to see them squat on one leg and squat with two legs. Those single leg exercises are more like sport. If you look at almost every sport, running, jumping, basketball, soccer, all these things, you see a lot more single leg patterns than you do bilateral stance. Ironically, my favorite sport, golf, is a bilateral stance, but but we do a lot of single leg training because it also shows us deficits that we might not see in our athletes. Anyway, so there's 10 buckets. Now, what if you work in a special population? Hey, I work with baseball pitchers. You might add in an 11th bucket that's all about arm care, right? I don't know that population that well, although I know a few folks that work in it, and they always seem to be doing a lot of work about arm and shoulder care. Totally fine. What if you work in a special population of old geezers, as my father-in-law calls them, but old people? Maybe you say, hey, we want to have a bucket of the ability to get up and down off the ground, right? That's super important in this world. So we need to make sure that we train it as a focus of exercise. But these are the 10 priorities of training of exercise, right? Is these big patterns of movement. I have one client who works with a lot of gymnasts. So actually she does a lot of work in the wrist and forearm because it's such a big player. Wrist, hand, and forearm, it's such a big player in gymnasts. That's one of their buckets. That's totally fine. All right. Maybe you work with a lot of soccer players. You want to go laterally. That's an excellent bucket to add in. Or maybe you want to just say, instead of single leg squats, we're going to do lateral lunges, something like that. Fantastic. That's up to you, but I would just say create those buckets and then start organizing all your exercises in that. So with that, remember too, that certain exercises can be in multiple buckets. And if you're looking for training efficiency or rehab efficiency, this is a great way to do it, is bias towards exercises that incorporate multiple patterns. Excuse me. And in this one, this guy is doing a cable lunge and a row. And actually what I see is he's moving, he's doing a single leg deadlift almost here, single leg deadlift. So he's getting that hinge pattern, he's getting the row pattern. And because that he only has one handle of that rowing machine, I think he's getting an anti-rotation core exercise as well. So this is hitting a lot of good stuff here. This is awesome. I love exercise like this. They're super efficient and high effectiveness. So remember, exercise may be in multiple buckets at the same time. Okay. So what do we do next? Well, now, once we have our buckets, we got to start organizing all of our exercises in there. And so this is what I would call the Instagram challenge. There are so many exercises on Instagram. It's fantastic, but we want to just make sure we know what bucket they end up in. So when we have a patient or an athlete who needs an exercise in that bucket, we can easily select the exercise out of there and know, is one exercise easier or harder than the other? So we're going to organize. So I just grabbed a clip from Eric Cressy and his Cressy Sports Performance down in Massachusetts. And here's a baseball pitcher doing a lateral lunge to one arm cable row, right? And the right leg on this athlete is moving. It's moving to the right, and he does a lateral lunge. Now, so what buckets does this fill? Well, definitely it's a one arm row. So we're going to get that horizontal pull. I think we're also getting the anti-rotation bucket. And I think we're also getting that lateral squat bucket. Now, in my version, I don't put lateral squats any different than regular squats. But if you work in a population that moves laterally a lot, or you want to create some more power in that, then adding that 11th bucket of lateral squats would do it. In my world, I would say this is just one of many squats we do. So I'm just going to put it in the squat bucket, the horizontal row bucket, and maybe some rotation bucket. Of all of those, I think it challenges the squatting pattern the most, and then the horizontal row the second, and then rotation the third. I don't think it's going to be that challenging of a rotational exercise, but I think it's fantastic that it can go in all three buckets. You can decide where you want to do this.
That was Dr. Josh Satterlee with our clinical conversations on the Smart Chiropractor Show, managing athletes through progression and regression. My big takeaway from that are a couple different things. Number one, I love the concept of buckets, simplifying things. That enables just like a phone number, the first couple, and then the last, it allows you to store more information up here, which is always good. There's a lot of joints in the body. There are so many exercises that you could do, that having a system and a process to be able to classify them can be so helpful then when you see that athlete inside of your own practice. And the secondary component to that stands out to me, ties to what he said at the very end, and that was highlighting some of these individuals to follow. There's so much fantastic information out there in the sports performance and movement realm. I'd encourage you to really curate your feed, your personal feed on Facebook, on Instagram, whatever it might be, and follow some of those individuals. You'll get great ideas for content yourself. You'll see how other people are doing it, and you might pick up some clinical tips along the way. Jason, what were your take-home thoughts with Josh's presentation there?
What I love so much, I'll keep it high level, is that it really gives chiropractors the opportunity to direct the conversation. And what I mean by that very specifically is if you just go, hi, I'm a chiropractor, most people go, oh, can you crack my neck? Or I never need one of those. Thankfully, as ridiculous as people sound. And the unfortunate reality is they sound that way because of us, because of what we are doing and because of what we're not doing. And I think Josh's presentation really points out that whether you build a gym in your practice, whether you make recommendations for exercise, it doesn't matter to me how you implement it, but the thought process behind it is that you're helping people perform at their best, perform better. There's a difference between rehab and exercise, even though some of the physical motions may look very similar, it may even be the same. The intention is different. So I really love the idea that you can sort of bring people to the conversation of high performance, of being proactive. Most people recognize that, being in shape is not something you do when you've not done anything and you've allowed yourself to become obese or overweight or whatever it may be. It is something that occurs as a natural byproduct of staying proactively moving, exercising, stretching, and knowing that a pain could interfere with that process really is a different conversation than, hey, wait until you can't take it any longer. When it hurts really badly, come on in. We'll see if we can give you a few visits to get you back doing the lifestyle that's probably caused all that damage in the first place. So I get you got to meet people where they are, but I love when docs can lead the conversation and attract people who want to literally and figuratively move in that direction.
Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.